Hello everyone, now let us discuss about some of the common disorders of digestive system part 1. Now coming to peritonitis. Peritonitis is nothing but acute inflammation of peritoneum, and a common cause of it is the contamination of the peritoneum by infectious microbes, which can result from accidental or surgical wounds in the abdominal wall or from perforation or rupture of abdominal organs. In some cases, the bacteria gain access to the peritoneal cavity through a intestinal perforation or rupture of the appendix that can produce a acute life-threatening form of peritonitis. A less serious but still painful form of peritonitis can result from rubbing together of the inflamed peritoneal surfaces. And the increased risk of peritonitis. The patients who are under dialysis, especially peritoneal dialysis, they are at higher risk to attain peritonitis. The increased risk of peritonitis is of particular concern to those who rely on peritoneal dialysis, a procedure in which the peritoneum is used to filter the blood when the kidneys do not function properly. Next, coming to mumps. Mumps is the inflammation and enlargement of parotid glands, which are one of the three major salivary glands, accompanied by moderate fever, malaise, general discomfort, extreme pain in the throat, especially when swallowing sour food or acidic juices. And in some cases, swelling occurs on one or both sides of the face, just anterior to the ramus of the mandible. It is an inflammation and enlargement of parotid glands. Next, coming to GERD or gastroesophageal reflux disease. GERD. If the lower esophageal sphincter fails to close adequately after food has entered the stomach contents can reflux, that is back up into the superior portion of the esophagus. If the lower esophageal sphincter fails to close adequately after the food has entered the stomach contents can reflux, that is nothing but back up. And this condition is called as gastroesophageal reflux disease or GERD. The hydrochloric acid from the stomach contents can irritate the esophageal wall, resulting in the burning sensation that is called as heartburn, because it is experienced in the region very near to the heart and it is unrelated to any cardiac problem. Drinking alcohol and smoking can cause the sphincter to relax, worsening the problem. The symptoms of GERD are often controlled by avoiding foods that strongly stimulate the stomach acid secretion. For example, coffee, chocolate, tomatoes, fatty food, orange juice, peppermint, spearmint and onions. Other acid regulating strategies or other acid reducing strategies include taking over the OTC, over the counter histamine 2 blockers, H2 blockers, such as Tagamet HB or Pepsid AC 30 to 60 minutes before eating to block acid secretion, and neutralizing the acid that has already been secreted when the antacids such as TUMS or Malrox, MAAROX, are administered. Symptoms are less likely to occur if the food is eaten in smaller amounts and if the person does not lie down immediately after a meal. GERD may be associated with cancer of esophagus. The next condition is pylorospasm and pyrolic stenosis. Two abnormalities of the pyloric sphincter can occur in infants. In pylorospasm, the smooth muscle fiber of the sphincter fails to relax normally. So food does not pass easily from the stomach to the small intestine. The stomach becomes overly full and the infant vomits often to relieve the pressure. And pyrolospasm is treated by drugs that relax the muscle fibers of the pyrolic sphincter. Next, coming to pyrolic stenosis. Stenosis is nothing but narrowing. Pyrolic stenosis is the narrowing of pyrolic sphincter that must be corrected surgically. The hallmark symptom is projectile vomiting. The spraying of liquid vomitus some distance from the infant. Next, coming to pancreatitis and pancreatic cancer. Pancreatitis is nothing but inflammation of pancreas, and it may occur in association with alcohol abuse or chronic gallstones. In more severe condition known as acute pancreatitis, which is associated with heavy alcohol intake or biliary tract obstruction. The pancreatic cells may release either trypsin instead of trypsinogen or insufficient amount of trypsin inhibitor, and the trypsin begins to digest the pancreatic cells. Other causes of pancreatitis include cystic fibrosis, high levels of calcium in the blood, which is nothing but hypercalcemia, high levels of blood fats, that is nothing but hyperlipidemia or hypertriglyceridemia, some drugs, and certain autoimmune diseases. Next, coming to pancreatic cancer. It usually affects the people over 50 years of age and occurs more frequently in males. Typically, there are few symptoms until the disorder reaches an advanced stage, and often not until it has metastasized to other parts of the body such as lymph nodes, lungs, or liver. The disease is nearly always fatal and is the fourth common cause of death from cancer in the United States. Pancreatic cancer has been linked to fatty foods, high alcohol consumption, genetic factors, smoking, and chronic pancreatitis. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.